This is an extended bonus episode of Season 7 of Catalyst, an investigative podcast from KXAN News. I'm Josh Hinkle. Over the past several episodes, we've explored a 60-year-old death of a teenager in the Texas Hill Country, and its ties to an antiquated system of elected officials still in use across the state to determine how someone died. In the last year, as our team investigated, we also faced record roadblocks and interview denials, making reporting on this already complex topic even more challenging. But it's important you understand why we pushed forward. Here to discuss are some of my collaborators on this project and fellow KXAN journalists: Senior Investigative Producer David Barrere, Investigative Reporter Arezow Doost, Senior Science Reporter Eric Henrikson, and Investigative Producer Dalton Huey. I want to start with Dalton. Oversight of justices of the peace, death inquests, and autopsy orders may be lacking in Texas. You discovered there is no central repository for the public to request related information because each county maintains its own records, which you saw were sometimes incomplete, heavily redacted, or costly to obtain, right?
Yeah, so our first plan was to request records from every justice throughout Texas. There's almost 900 of them. We learned immediately that this wasn't going to be realistic. So many of them had issues with resources, couldn't pull the data, didn't know where it was. If they did, just the amount of time and money was going to cost for them to do it and then for us to pay for it, it wasn't going to be possible.
And further tracking any potentially troublesome trends can also be challenging, even by securing individual death certificates, which are sealed by law from the public for 25 years after each death, as you found. That means the most recent death certificates available in Texas date back to 1999, right?
Yeah, so in order for us to know who it was that passed away in any circumstance surrounding their passing, we had to go back 25 years. And so death data is available more currently. It doesn't give us the same information, the same context that we need for the investigation. So yeah, more or less we were able to pull 1960s to 1999, but any actual information related to the circumstances of the death or the investigation after 1999 are sealed because of Texas law.
With the Danon Lewis case specifically, we know law enforcement records from the 1960s in that Burnett County precinct are missing. How did you end up piecing together more of what happened there and more about the JP in that case?
One word is archives, whether it be digital or actual physical archives that we had to go through one at a time. Multiple online digital archived resources for death certificates, for newspaper clippings, and then visiting museums, visiting historical libraries for archived newspapers, microfilm, going through a day at a time, a newspaper at a time to try to put together the picture of what happened here and who this JP was at the time. And then in addition to that, we spent time in Marble Falls. A lot of the people here that were alive in 1965 are still around and they remembered it. And we learned a lot of great, valuable information about this case from them as well.
So David, there really is a patchwork of different death investigation systems in the U.S. You've researched the problems that presents, especially on state borders where a community stretches into multiple types of systems, right?
Yeah, so in Northeast Texas alone, our state borders 3 others: Oklahoma, Arkansas, and Louisiana. And so I looked at Texarkana, which is a unique city, and it has a border with Arkansas running right down the middle. There's even a post office in the middle of Texarkana where the state line goes like right through the middle of the post office. And so on one side, hypothetically, if someone were to die on the east side, coroner from Arkansas would handle it. And on the west side, a justice of the peace in Bowie County, Texas would handle it. And in Arkansas, a body could be sent to Little Rock in a medical examiner's office. And in Texas, it could be sent to the Dallas area. I spoke with a coroner from the Arkansas side, and she said it does present some unique issues when, for example, someone may have had an accident on the Arkansas side of the city where they have no hospitals. So they could be transported to the Texas side where there is a hospital and die, and then that would present a unique problem because there's not really a continuity of law enforcement where the crime occurred in Arkansas, it's emblematic or highlights how different systems in different states can present these unique issues when it comes to people dying.
And there is no national standard when it comes to these death investigations.
And that's why we've seen different systems grow in each state. On the one hand, there is a sentiment from medical examiners that states and communities are better served by a medical examiner's office, which are led by doctors. On the other hand, pretty much everyone involved in the death investigation ecosystem acknowledges that the cost and feasibility of implementing medical examiners everywhere is pretty much impossible right now. ME offices are more expensive, and there aren't even enough qualified medical examiners in America to do all that work.
Tracking the different types of systems can be challenging, I know, because some states, like Texas, have multiple systems, right?
Yeah, it is difficult because each state has sort of grown its own system over the decades to meet the needs of its own budget and geography. Luckily, the CDC, or the Centers for Disease Control and Prevention, keeps pretty good track of how each state works. So I leaned on that data in my research, and then I also looked into each state individually to see what those nuances in each system was.
And Texas is unique in using justices of the peace for death investigations. They're elected, which most coroners are too, but JPs have a lot of other responsibilities.
Right. They are judges, they handle small claims court and the lowest level misdemeanors, and they also do marriages. So their work is pretty wide ranging. I'll give you an example. In Williamson County, we spoke with justices of the peace there, and the population has boomed there in the past decade. That's put a strain on the JPs to be able to handle the judicial workload along with their death investigations. So the county has agreed to hire specialized death investigators there for each office to help handle that workload.
Eric, when we were looking at the different level of expertise between a justice of the peace doing inquests and a medical examiner performing that role, what are some of the biggest differences when it comes to background that you found?
So justices of the peace, they can seek out training for death investigations. For a medical examiner, you're looking at years and years of study. They have to have a college degree, they have to go to medical school, they have to go through multiple accreditation programs, they have to do a fellowship. It's 9 years at least of training they're going to have to go through before they can actually become a medical examiner. So you're looking at nearly a decade of training versus maybe a couple few week courses they can take.
Now, JPs don't conduct autopsies, but they can send bodies to counties with medical examiners or private services to have autopsies performed.
There is a cost to the county. $4,700 per body is one of the prices we've seen. They can also reach out to places like Texas State University that has an anthropology program where they examine skeletal remains. So they have a few different options available to them.
There are only 14 county medical examiners in Texas and a handful of private entities. We had some challenges getting those offices to talk and show us what things looked like inside.
Some just said no comment, they don't want to talk to the press at all. Others had difficult relationships with the press, but all we were looking for was background information just to see what the office looks like. There's a lot of eyes on the medical examiner's office in the state of Texas, and I think those concerns have led many people to think that there's a negative perception of those medical examiners, even though in this case we're looking at them from a scientific angle.
And of course there's probably some privacy and maybe health concerns as well.
Right, if they have an autopsy going on, they have to get special permissions. People were really concerned about what we saw, if there's any medical records up on the walls, that kind of thing. We were eventually able to get into the Travis County Medical Examiner's office, and they had to set aside a room for us that had no examinations occurring that day. They had to make sure everything was clear with all the doctors there, the staff there. So there's just a lot of steps.
While you were able to talk to one of the trainers and see training material online, officials still wouldn't let us attend the trainings or see inside the training center. Why?
Well, they shared photos of the training that have happened over the last several years. And of course, they provided all the materials that they use to educate the judges. And part of that is for the safety of the Justice of the Peace judges. And also, they want them to be able to focus on the education.
When it comes to JP discipline, I know we ran into challenges. Only the last 25 years of records are readily available to the public online through the Commission on Judicial Conduct. And even then, often they can be hard to navigate and find specific information. What else did you learn, Arezow, about discipline?
Well, it's something that didn't exist, when the system started 200 years ago. It really came on board in the last several decades where the focus has been on accountability.
Now, looking to the future, the population threshold requiring certain counties to add a medical examiner office, as opposed to JPs doing death inquests, will likely be coming back up next legislative session. You tried talking to a lot of lawmakers who've dealt with this issue in the past, but we ran into some roadblocks there.
This is something that we worked on for months, trying to figure out which lawmaker was going to tackle this issue this next session beginning in January. And we ended up going back to all the lawmakers over the last decade that have really done something when it comes to population threshold legislation. And at first, it was not easy to get a sit-down interview with them and to have an understanding of why the changes have been made in law. And one of the lawmakers that we wanted to hear more from was Senator Tan Parker. Interestingly, he's heard concerns and he is willing to look at the issue this next session to see what needs to be done so that it helps all of Texas. He did say, and we've heard this from other lawmakers, there is not a one-size-fits-all solution for this problem. So they've got to be really creative and they've got to think about, okay, how do we give counties control to decide if they need a medical examiner's office or not, or what do we need to do as a state to make it a requirement?
To learn more about this case, watch our docuseries and explore our digital investigation online now at kxan.com/Backbone Creek. Catalyst is reported and produced by me, Josh Hinkle, along with David Barrere, Arezow Doost, Eric Henrikson, and Dalton Huey. Our editor is Richie Bose. Digital support comes from Robert Sims and Kate Winkle. KXAN's news director is Haley Syhawk, and its general manager is Eric Lasberg.